Good morning. Good morning, everyone. Welcome to day 2. I just have a few announcements to make this morning before we get started. Please remember the exhibit hall is open until 5 p.m. today, and today is also the special 20th anniversary panel presentation, and that's at 4:30 in this room. Remember, in order to get continuing education credits, you must complete and hand in a verification form at the registration desk prior to departing on your last day of attendance. You can access the PowerPoint for this presentation on the Groupio app and also on the website. And then we also would appreciate your feedback for the presentation on the Groupio app as well. Uh-oh. Did I make your presentation turn purple? Hold on. Oh, don't touch it. All right. Another special announcement. There will be a special gathering of early intervention aged children and their families in room 109 today at lunch. The Patton EITA consultants and Elwyn parent partners will be there for a meet and greet. So please grab your lunches and meet in room 109. And now I have the special privilege of introducing Dr. Alice Schillingsberg. Dr. Schillingsberg received her PhD in clinical psychology at Auburn University. She's currently an assistant professor in the Division of Autism and Related Disorders in the Department of Pediatrics at Emory University and the director of the Language and Learning Clinic at the Marcus Autism Center. Dr. Schillingsberg is a licensed psychologist and board-certified behavior analyst at the doctoral level. Her clinical expertise includes developing language and behavioral programming to address a variety of behavioral difficulties and communication deficits associated with developmental disabilities and autism spectrum disorders. Dr. Schillingsberg is associate editor of the Analysis of Verbal Behavior, editorial board member of the Focus on Autism and Other Developmental Disabilities, and former editorial board member of Journal of Applied Behavior Analysis. Her current research interests include theoretical and practical applications of verbal behavior and the assessment and treatment of language deficits, particularly strategies to promote language acquisition and social interaction skills in children with autism. So please welcome Dr. Schillingsberg.
Good morning. How's everybody doing? How's the mic check in the back? Everything sounds great. Love the thumbs up. Active participation already. Great. Thank you for that introduction. I'm thrilled to be here. You heard a little bit about my background and my sort of credentials and why I'm here talking to you about ethics. First and foremost, I'm not an expert in ethics. I'm here to facilitate our growth in ethics today. And as a group, we're going to talk through lots of scenarios and kind of think about how we can integrate an ethical process of decision making as we leave here today. So I may not have all the answers, but hopefully as a group we can talk through some of these scenarios and all leave here better prepared to serve the individuals that we work with. If at any time I start to drift, y'all just let me know, and I'll get back to the mic. Okay, so I know how we all feel about a 3-hour ethics workshop. Kind of like this. Oh, I'm glad I got a giggle, but a lot of people think when I put this picture up that I went on Google Images and pulled a picture. This is my actual 2.5-year-old son. This is the school picture they sent home to me. That's right. And then when I said, can you do a better job, they did a retake, and this is what I got. So I hope if we're starting off the day like this, I'm hoping by the end of the 3 hours we we'll be in a little better mood and a little better prepared to sort of approach the day. So, and I get to show cute pictures of my kids. Okay. So some of our objectives for today, we're going to review very common ethical guidelines. I think that's really important because they're the ones that come up regularly. So we're going to talk about confidentiality and integrity, science backing the things that we're doing, our responsibilities and where they lie, and boundaries with the people that we serve. We're also going to review some underemphasized and less common ethical issues. Sometimes if they're underemphasized or less common, we're not as prepared when they do pop up. So we're going to talk about some things that might go on if you're training or delegating tasks to people. The importance of knowing the code, which you guys are all on the right track to doing that today. Talk a little bit about harmful reinforcers and what that might mean. And then professional development. And then lastly, hopefully, if we have time, we're going to talk about some emerging areas with ethical concerns, use of technology, telehealth, and social media, and how that might interact with your practice with individuals with developmental disabilities. Okay. And then the very last thing that I'm going to talk about today, and I hope I have lots of time, we may skip around depending on how actively participating everyone is. We're going to talk about some useful skills and procedures to ensure ethical practices. And sometimes when I go to ethics workshops or have ethics conversations, it's like, well, that's what you should do. Okay, but how? Ethical situations are uncomfortable and difficult. And so we're going to talk a little bit about that today. Things like knowing the code, putting things in writing ahead of time. I'll have some really nice examples for you today. Going to have some tips on some communication skills and when and where to find some supervision when you need it. Okay, so just some resources so that you know where I'm kind of pulling this. It's not just my clinical experience. People familiar with this book? Great. So this is a great read. When I've taught ethics at the graduate level, we've used this text. It's got some really nice resources in it, and I pull from this heavily and enjoy hearing Dr. Bailey speak on ethics. I'm also going to be, just verbatim going through some of the codes that you can find at thebacb.com. And then I also pull pretty heavily from a book called Crucial Conversations, Tools for Talking When Stakes Are High. I've been through a 2-day workshop on communication skills and dealing with difficult situations. And believe me, ethical situations are difficult situations. I'm not necessarily plugging this book. There are lots of books on how to have useful, productive, rational conversations with people. And I highly recommend honing those skills as you're out there practicing. And then, of course, my own clinical experiences. So I want to talk about why we're even here. I mean, we all know you've got to get the CEUs, but really from a broader perspective, why do we talk about ethics? We're not talking about ethics so that we don't get in trouble, right? I think that people go into talking about ethics thinking that, but in reality, that's not why we talk about ethics. And one way to think about why we talk about ethics and why it's so important is to try to answer these questions. Anybody have an answer for me? What do you love about your job? Helping the kids. Yeah, in the back? Say again? Oh, that worked. Okay. Protecting our kids. Yeah. Some of us work with very vulnerable populations.
Helping parents and other educators.
Yeah. Something you love about your job is helping parents. Maybe you can really relate to parents and what they're going through. Educators. Why did you become a behavior analyst in particular? You can help kids in a lot of ways. Say again? Because of the skills that it gives you, yeah? It's evidence-based. Go ahead.
My arm got twisted.
Your arm got twisted. I like that you're front and center. I'm just kidding. Because it works, right? Go ahead. Yeah, behavior analysis is a powerful, powerful, powerful profession, right? We, in order to do the things that you guys just said you love about your jobs, behavior analysis is one of the best ways. It is a really, really exciting way because we see the results right away. This is why we're going to talk about ethics today. We talk about ethics because we need to be our best selves to accomplish the things that you guys just said to me, to help kids, to protect kids, to help parents, to help educators. That requires that we are our best selves. Our clients' burdens are our burdens, and we need to be equipped to bear those burdens when they can't. Our families, our teachers, our kids are struggling every day with the things that are impacting their lives. And so it's really more our responsibility to be the top of our game. It's our responsibility to make sure that we don't have dual relationships, to make sure that we select what's scientifically based. It's not their job to do that. It's our job to do that, is really to protect them. And that's why we talk about ethics. Let's talk a little bit about the core ethical values, just to really put this in perspective. The first one here is do no harm. And if you think about that quote that I put up there, I learn ethics because I don't want to lose my license, right? So yeah, this is one, do no harm. That's important. But if you look at every other one, it is not about not messing up. It's about doing the best you can do, respecting people's autonomy, benefiting others, being just, being truthful, treating others with caring and compassion. All of those things are sort of positive things that you're striving for, not things that you're trying to avoid. And I think that's really important as you dive into ethics, is to think about that and not necessarily what's going to get me fired, what's going to get me in trouble. Those are important. We want to make sure we're not doing those things. But that, to stop there, does not make you your best self as a practitioner. So I've never shown this video clip. I've given a lot of ethics workshops. I've never shown it before. I want to talk a little bit about some touchy-feely stuff. We'll get it out of the way. But I want to talk about it because these, to me, talking about empathy and compassion is one of the best ways to keep ethics and those other core values at the forefront of your mind. So if you think about empathy and compassion, compassion is a sympathetic consciousness of others' distress and a desire to alleviate it. When I asked you what you love about your job, that drove a lot of it. Your desire to alleviate distress in the people that you're working with, parents, educators, children. Oh, did I do that? Sorry. Compassion is great, and probably everybody in here feels a deep sense of compassion or you wouldn't be in a helping profession. But compassion alone can get you in trouble because your desire to alleviate the pain and suffering of somebody else can lead you to make some decisions that might lead to dual relationships, that might be a problem. And so you also have to have empathy, which is the ability to understand and share in the feelings of others and see the situation from their perspective. So it doesn't matter what your intention is. What matters is how they're perceiving what's going on. And so all of the scenarios that we're going to talk about, a lot of them sound fairly benign. Like, oh, well, it was in, the best intentions. But you always have to think about how is the client perceiving or experiencing the decision that you're making. And that, I think, can really elevate you to be the best practitioner you can be, the best clinician, the best educator, the best speech person, all of those things, if you can think about things from the perspective of your client. So we're just going to try this. If you don't have a tissue, I apologize. And it's about 4 minutes, so I might cave on it if people are not liking it. Like I said, I've never shown it, so give me feedback in the eval, and I'll leave it in or take it out. But I was very moved by this. Hopefully it will work. Oh, no. Any ideas? We might not watch it. Yeah, I might not be able to.
Are you connected to the internet?
I have no idea. I asked.
Let's do this.
Okay. Oh,
Okay, let's try this.
yes,
Do you need to be hooked into the internet itself?
Yeah.
I think so.
Because I've had problems on presentations where
Okay. Well, we might skip it. You guys should write it down.
called the guy in.
Watch it at lunch. You will be. I want to show it.
See if it works. Let's try it, and also let me jiggle your.
Says no internet. Okay.
Try to click it. Just see.
Now I can't get back to the resume. This will teach me to do new things. Sure.
I'm
It
on
won't.
the male side of the spectrum, and that top line up there gets me really nervous.
The touchy-feely stuff? Well, it's kind of a joke, just talking about empathy and compassion. Yeah?
You know, hugging kids, maybe people on the other side of the spectrum can do it. I can't.
I don't know how to get it to go back to the slideshow now, even. Here he comes. Well, I wanted to connect to the internet, but I don't know how to do that. I should have done it before we started.
It's a YouTube video.
Yeah.
Looks like you might have already been connected, but for some reason it's problems here.
I'm okay with skipping it if we have to. Okay, let's just skip it.
You gonna skip it?
I think so, unless you have a fast.
No, the only other thing I could really do is restart the computer, so I don't know.
Okay, let's not do that.
Get it back on the presentation.
Yeah, we can't even get the slideshow to come back up.
Oh, you can't.
Mm-mm.
Which slide were you on?
Just good. It's probably 5 or 6. Keep going, and like it's keep going. Keep going. Anyone is fine. I'll just fast forward. Yeah, it's not. I did that and it didn't.
That's very strange. Sorry, that's
Sorry, guys.
Yeah. There we go.
Oh,
alright.
No.
no, that didn't work at all.
Nope.
That's not it?
That's
What?
fine, right?
It's got the bar at the bottom, right?
It shouldn't be there. I apologize about this. There you go.
Okay. All right, guys. Well, there goes my momentum. Okay, so we'll see. Maybe during the break I can get it to work and we'll watch it. But in general, it's a video about seeing things from another person's perspective and really understanding that the people that you encounter are going through things that are different from what you're going through. And so, in a nutshell, it really is about when schools, teachers, parents are making demands of you or asking you to do things that might have ethical implications. It's not necessarily because they have some ill intent. It's oftentimes because they are desperate to do anything that will help the situation. And so I think it's a very helpful video to watch to really keep that in perspective. But maybe we can watch it after the break, and you can all bring your tissues. Yes, yes it is. So ethical issues are much easier when you consider the other person's perspective. And so as we go through scenarios today and at the end when we talk about resolving ethical dilemmas, I'm going to encourage you to try to do that. Okay, so we're going to dive right in. As you all may know, there are brand new guidelines that came out in January of 2016. How many of you knew that? I won't tell anybody. Okay, everybody knows. Great. And so there's now one document that has replaced the code, the conduct guidelines and the disciplinary standards, and there's just one document. So it's a lot easier to sort of understand. And there are some important changes, and I'm going to highlight those as we go through. But there aren't too many, which is nice. A lot of the wording is very, very similar, if not identical. So we're going to do lots of case studies. Let's just dive right in. This is the participation portion, and you guys so far have been awesome. So let's just read through this. Sally is a BCBA working in a fairly isolated geographical area. She is the only BCBA for over 100 miles. There's one licensed psychologist in the area with a generalist background who mostly serves adult and marital issues. Sally specializes in skill acquisition and problem behavior reduction in children with autism and related developmental disabilities. One day she gets a call from a parent of a child with selective mutism who's looking for evidence-based treatments for her child. What should Sally do? Okay, so say that you can work with this family but seek out the training and the supervision. Or refer. Looks like probably referral might not be an option. Yes?
I was going to say that depending on the area you're in, if you cannot refer, then, cases like that where there just is someone, we can bring some to the same area. Parts of Colorado, I lived there for a minute.
Mm-hmm.
They're tiny and it's
Yep.
remote and you're driving hours to get there. So in that case, you have to, it's upon the professional, if you take on the case, to seek out active supervision, not just, read a couple of articles, but actually find someone who does this type of treatment who's going to give you the, kind of
Yeah.
a high-end supervision.
Yeah, so not just reading some articles, but seeking out active supervision.
If you were in this situation and say that there wasn't anybody, in that state or nearby that has this area of expertise, is this something you could, collaborate with, like, through, like online and video and things like that, to kind of get that hands-on supervision per se? And then also, what resources do they have to find people like that?
Mm-hmm.
Different areas of expertise.
Yeah, great. So some similar ideas here about seeking some supervision, but maybe even using video online options if you can't do something face to face, and that might be better than phone. Resources to find, where somebody sort of lists, I have expertise in this and would be willing to supervise. I don't know that exists. Yeah.
I haven't run into this before. The first thing I would do is ask the parent, what have you done already?
Mm-hmm.
Because you'd be surprised at what they've done. All right?
Yeah.
That'll eliminate a lot of your effort
Yeah.
that you would have done.
Okay.
That'd be the first thing I'd do is go from there, telling her I have no expertise in that area,
Yeah.
but what have you done? Maybe
Yeah.
I can help you find something.
So saying I have no expertise in that area and helping them find something. So how many of you are familiar with selective mutism? Several people, great. How many of you knew that the evidence-based treatment for selective mutism is stimulus fading and reinforcing successive approximations? Several people. So that's great for such a rare disorder, but a lot of times we can jump to the conclusion that we don't have any expertise. That we don't have any expertise when in fact we may have some transferable skills. And it may not be as daunting to think about helping this family with active supervision. So all of you sort of were absolutely on the right track. So is she competent? It sort of depends. She probably, as a behavior analyst, knows quite a bit about stimulus fading and quite a bit about reinforcing successive approximations, but probably doesn't have any idea about selective mutism and that sort of thing. But she could potentially gain that competence, and given the geographical location, she might want to attempt to do that. And so what does the code tell us? Is certainly reliance on scientific knowledge, which echoing some of the information that we got over here, doing some reading, educating yourself about the diagnosis, and then reaching out to get active supervision from somebody who is in the field. And it tells us that we conduct research, provide services, and teach in new areas only after first undertaking appropriate study, training, supervision, and/or consultation from persons who are competent. Now note that those things are not necessarily operationally defined here, which introduces some wiggle room, and that's what makes ethics somewhat hard. So it doesn't say, you know, how much is appropriate study, what is consultation from a qualified person, and those are the things that you have to work through as the practicing behavior analyst. So also related to this is professional development, making sure that you're reading the appropriate literature, attending conferences and conventions, participating in workshops, obtaining additional coursework, and or obtaining and maintaining appropriate professional credentials. So all of this goes to being competent as we're serving the clients that we are serving, and as you're starting to branch out into new populations and new presenting problems. The code does not say you can't do that. It offers guidelines for how to do that. So in terms of professional development, it's pretty clear that attendance at conferences is one of the suggested ways to do that. You guys are all doing a great job being here at the National Autism Conference, regional conferences. There's all sorts of ways to conferences all over the country. Now, keeping up with the literature can prove kind of daunting to practitioners. How many of you have access to a full academic library if you are not a student? How many of you do not? Yeah, okay. So keeping up with the literature can be a challenge, and that is one of the best ways to keep up to date with what is going on and what is peer-reviewed. So keep in mind that going to conferences is awesome, and listening to speakers that have a track record of doing stellar work is great, but it's not peer-reviewed, right? So you can go to things at conferences that look great, that are convincing, that sound wonderful, but it's not the same as published literature. And so having access to published literature is a crucial component to being a skilled and competent practitioner. This paper came out in 2010 by Carr and Briggs, which is called Strategies for Making Regular Contact with the Scholarly Literature. And it's specifically designed for people who are done with school, I'm out practicing, I'm not on faculty somewhere, and what are some ways that I can do this? So I won't go through kind of everything, but they make some really great points here. Lack of library access, lack of databases, lack of access to journals because you have to pay for them yourself, and then finding the time to prioritize that reading can be a big challenge. So they make some suggestions for solutions. You can get an individual subscription to something like PsycInfo, but it's very expensive. You certainly could talk with an employer for your organization about a subscription, an organizational subscription. So I'm on faculty at Emory, but if I weren't, I also work at Children's Healthcare of Atlanta, which is just a non-for-profit hospital. It's not an academic institution, but we have a librarian, and they regularly ask us what journals do we want access to, and they put that into the budget. Now that's different if you own your own company and it's a small company, but something to think about for those of you who work for larger organizations. They also suggest reaching out to your alma mater and asking about graduate access. So for people who have graduated, is there a reduced price to maintain that access? Some other things to keep in mind is that a lot of articles are free online. Some journals have what's called an embargo, which means that when a new journal comes out, there's a certain period of time that it is not free, but then after, say, a year or 2 years, then it's just freely available. So that does put you behind a little bit, but not as much as it may feel like. So keeping that in mind, that if you aren't familiar with the website PubMed Central through NIH, you can get JABA through there. There are other ones as well. So a great place to access free journal articles. And I recommend contacting authors to send you a reprint. I probably get an email a month asking for access to an article of mine by people who are practicing and just don't have access, and they want to read the article, and I happily send those. I would be shocked if there were authors that were to say no to that. Yes. Yep. Great suggestion. ResearchGate is a place where you can sign up. I'm on there, and that's a great way to, actually the most recent one that I sent was a request through ResearchGate. Thanks for mentioning that. Okay, so solutions to the amount and timing of research. So this is the other thing, is that people publish outside of JABA, right? There are loads of other journals, and they have different publication dates and timelines. Some journals come out once a year, some come out 4 times a year. And so to be able to keep up with all of that can be daunting. So it can be difficult to follow that newly published work. One way that you can do this is to organize a bookmark panel in your browser so that you can just go straight to the ones that are your top journals. You don't have to go through multiple steps. And oftentimes, in-press articles are available online before they come out in the subscription. So that's a really great way to stay as up-to-date as possible with new things. You can also go to journal websites and sign up to have the table of contents emailed directly to you. I get several of these that come, and so I don't have to remember when journals come out at all. It just pops up in my email. I can see all of the articles that are about to come out, and I can make notes of and click on the ones that I want to access that way. And then I can go about my business and not worry about it. You can see here the Journal of Applied Behavior Analysis, a place that you can do that here where it says Journal Tools, get new content alerts. You just click on it and sign up, and then they'll send it to you every time a new subscription comes out, and pretty much every journal has this. Okay, so the solutions to getting it done. One of the best ways is to arrange a journal club. This offers some peer pressure to make sure you're doing the readings and that you're attending. And you can earn CEUs this way. So where I work, we have a weekly journal club. I am our ACE organizational CEU provider. So whenever one of my BCBAs is going to lead the journal club, they send me the article, they send me their objectives, and then people attend. We have a lively discussion. They fill out an evaluation of what they learned and how they liked it, and then we distribute CEUs for free. And that's a really great way. So if you've got a group of a few BCBAs that work for your organization or work in your school, think about organizing a journal club and potentially becoming an approved continuing education provider, which is essentially filling out the paperwork and paying a fee. But if you have enough people who are coming to these journal clubs, if you think about how much a CEU costs, if you've got 5 people doing this every other week, and normally you would pay $10 for a credit, it might be worth it in the end. And then, of course, presenting at conferences is a great way because you have to keep up with the literature if you're going to talk to people about what's going on in the literature. Okay, let's move on to another very common code of conduct here, integrity. So behavior analysts are truthful and honest. We follow through on obligations and contractual and professional commitments with high quality work and refrain from making professional commitments that we cannot keep. So you can be as flighty as you want with your lunch plans with your friends. You can make and break agreements all you want. But as a behavior analyst, it is absolutely vital that you are making agreements to fulfill professional responsibilities to parents, schools, kids, whoever it is that you're entering into that relationship with, and that you are following through. It's absolutely in the code of conduct. And this requires that you think about yourself. Think about how much you can handle. How much are you asking the BCBAs that work for you to handle? They're required to live up to this code. So you have to be thinking about that as you're making plans in your professional commitments. We conform to legal and moral codes. I won't go too much into that. And it's our responsibility that if something conflicts with the law, that we make it known that our commitment is to the guidelines and we try to resolve it. Okay, let's take a look at this. The leadership at a large organization that provides behavioral services to children with autism and other developmental disabilities holds a finance and operations meeting with the BCBAs to discuss new caseload requirements for the next fiscal year. Currently, the BCBAs carry a caseload of 10 to 12 cases for comprehensive services. In order to boost revenue, the leadership team is increasing the requirements of the BCBAs to 20 to 24 cases per supervisor. What issues should the BCBAs consider and discuss with leadership? Yeah. Okay. Yeah, so definitely discussing what does that mean to double a caseload? What will that mean to the effectiveness of what we're doing, which of course is in the code, and then potentially refuse. Okay. Yep. Yeah, so one option, of course, the refusal, but another option would be, okay, how does this affect the quality of our services, but what could we put in place that might make this feasible? BCABAs, maybe, okay? Yeah, so there's not a right or wrong necessarily an answer. It is a process of talking through those things. The BACB in 2012 gave us a little bit of some help here and said that the caseload size for behavior analysts is typically determined by these factors: the complexity of the case and the needs of the client, the training and experience level and the skills of the behavior analyst, the number of hours of treatment each client is receiving, location and modality of supervision, expertise and availability of support of like BCABAs. So there's actually not necessarily a cut and dry answer. And if this were to happen to you, what sometimes could happen is that you could get immediately frustrated, potentially defensive, and say, the leadership of my organization doesn't seem to care about children with developmental disabilities if all they care about is money. Now, that is not an empathetic response to the leaders of your organization, who probably are not bad people. They're potentially making these demands without necessarily understanding the repercussions or the consequences of it. And as an ethical behavior analyst, your goal would be to have a rational conversation with them about what does this mean, come up with some solutions, and sort of leave the emotions off the table and not necessarily assume that they just want to double their money without any care for children with autism or whatever it may be. And it could be that a team could take 20 cases if they are less complex cases, they're maybe not getting as many hours per week, and we supplement with a few BCABAs. That's a possibility. Sort of talk through those things. Here he says, again, these are just guidelines, but it's always nice to have some tools for supporting your side of the story when you're entering into these conversations. The average caseload for one behavior analyst supervising comprehensive treatment without support of a BCABA is 6 to 12. So that 10 to 12 caseload falls right in line here without a BCABA. I've got a couple other things here. Again, you can find these guidelines on the BACB website. There's newsletters and links to things like this are absolutely useful. I highly recommend looking through them. Okay. Let's try another one. Dr. Smith is a BCBAD with expertise in problem behavior reduction in children with developmental disabilities. His neighbor Kate has a 6-year-old son who is not toilet trained. She asks Dr. Smith for his advice. Dr. Smith tells her that there are some good books on toilet training and provides some references. Then he shares a written behavioral protocol on toileting and gives her a data sheet. What do you think about his response, and are there any ethical concerns?
Recommended treatment, and I think the books, giving resources is always a great idea. Once you start giving a specific protocol without knowing why the child is not toilet trained, you don't know if there's a medical issue, we don't know anything that's going on in the home.
Yeah.
I think providing treatment without some historical information can be problematic.
Yeah, great point. So providing treatment without necessarily knowing what's causing it, what's going on in the home, without any historical information, but potentially providing the books and resources is A-okay. Yeah?
I think it's hard to tell. We don't know if this is his written protocol. I mean, you can find facts that has written protocols and data sheets all day long and hand them to someone and say, here are some resources.
Yep.
And it's no different than getting a book.
So what she's saying is, we don't know where he got the protocol. Did he write the protocol, or did he just, in his search for book references, come across a protocol online and print that out and give it to her? No, that's fair. But if you think again about empathy, so think about this neighbor's perspective when a doctoral level BCBA hands you a protocol, regardless of where you got it. What are you thinking you should do? You should do it. Potentially. We don't know. So it doesn't matter necessarily the intention of his, necessarily. We always have to think about, what could I be implying by accident? How could this person that I'm interacting with perceive the decision that I'm making here? I saw another hand back here. Somebody.
I was wondering how well he knew the neighbor. I mean, she could have lived beside him for 6 or 10 years, and he could know this child very well, or it could be somebody he hasn't had much interaction with.
Yeah, I think that that's something to think about. However, what else about interacting with the neighbor is the issue? A dual relationship. Yeah, in some ways, so could be a dual relationship if they are now entering into a professional relationship. Does this tell you that they're entering into a professional relationship? Yeah, they're not. There's a lot of stuff going on around here in this, scenario. And the interesting thing is that this type of thing happens a lot. When you have expertise in stuff that can help children, people want that. They want to ask you, and you want to give it. And especially, I think it'd be even harder if they knew this family for 10 years, or if it were a family member of his. You feel this this sort of compulsion to be compassionate, to do this for them, but it can get very tricky when you don't know the medical history. We don't know why this child is not toilet trained. Mm-hmm. Yeah. Mm-hmm. Yeah.
I have a neighbor who's a pediatrician, another neighbor who's like, they would think to ask me for free advice, but I would never, like my son was sick, it was the middle of the night, and I was like, do I want to throw him in the car and take him to
Yeah.
the ER? I would never have thought to knock on her door or email her, which I did, but when her daughter was having this kind of
Mm-hmm.
at least she was asking me, what did you say?
Yeah.
So it's hard,
Yeah, very.
because it's as if we're not at that same level to allow.
Well, throw another wrench in that is that everyone can go to a pediatrician, pretty much. How many people do not have access to a behavior analyst or somebody with specialization in autism and developmental disabilities? That in and of itself makes you feel compelled to help. So, it's a very tricky situation, but I think it's really important to think about always from their perspective, how they're going to encounter this interaction. And if there is a medical concern and all of that stuff, you would be in there'd be a lot of problems. Yeah. Did you have another?
Yes, I wanted to say that, where does he work? I mean, I'm associated with the clinic,
Mm-hmm.
right? And we have autism services there. And I would tell her to go there, so that, and you might see me there, but you're gonna go there and get a good evaluation.
Yeah.
Good background, you're gonna get all the stuff that we need before we can even start.
Yeah.
Start with that.
Yeah, absolutely. In addition to the resources, you can make referrals and give suggestions on where to go to start a professional relationship. Absolutely. Great suggestion. So here it's pretty clear in the code. We provide behavior analytics services only in the context of a defined remunerated professional or scientific relationship and role. So that is very clear. One issue that nobody really brought up, but probably was on the back of your mind, is when you hand somebody a protocol, you're making some assumptions about their ability to follow it and to understand the word reinforcement. I don't know about you, but every I don't know, a couple of weeks, somebody uses the word negative reinforcement and they mean punishment. You know, so the general population is not equipped to just take something that's in a written protocol and go and do it. And so that can be really tricky. That's one of the reasons why books that are written for parents can be a nice resource to get parents started, or teachers, or whoever. But the code is clear here that when we provide services, we use language that is fully understandable to the recipient of those services. Okay, here we go. Johnny is an 8-year-old with autism. His father brings him for services at a behavioral intervention clinic. In the initial intake, a team of 2 therapists, a male and a female, are working with the child while you, the BCBA, are interviewing the parent. In your conversation, the parent states that he doesn't feel comfortable with a male providing services. He goes on to say that this is because in his culture, and according to his religious practices, males are not caretakers for children. You feel yourself getting upset that this parent is asking for differential treatment based on gender. You start to think he must be very sexist. What needs to be considered, and what is the best course of action here? This happened to me, by the way. A lot of these things have happened to me. Yep.
First and foremost, you have to know yourself. So if you cannot objectively look at this case and work with this family, then you have to consider, I know therapist, the transference and counter-transference. Can I do this? If I can't do this, I'm obligated to refer to an actual viable, but not just refer.
Yeah.
Do I have to refer, or can I do this?
Yeah, my favorite thing about what you just said is that you have to know yourself. You immediately honed into one aspect of this. What was it? Getting upset. You immediately thought about that emotion, and that is always a telltale sign that there is an issue, that you need to think about yourself and your objectivity and your ability to move forward. So I appreciate that comment, absolutely. What about the demands of the parent? Let's take the I'm upset part out. Yeah. This is tricky. I agree. You have to respect people's culture. This is something that, I mean, is difficult. We want the best for the kids that we're working with, and you have to be able to think about the culture of the family of the child that you're working with, and try to integrate that. So, you know, it could be that this is something that you can respect and that you can accommodate. What if you have only male employees? Or what if the female is not available at the time slot? Do you pull a female team member off of another team where that family has built a relationship to switch to, you know, these are real issues that you have to kind of think through and talk with the families about, you know, the issues related to accommodating and making that happen.
Could you just say that this situation is temporary because they're just working with them initially while you're interviewing, but then after that, we can talk some more about what we have available, what you need?
I think there are numerous ways to navigate this situation with the family if you can take the emotion out of it, if let's say you can get past that. And I think at the end of the day, proceeding with services are always a combination of what the clinician can offer and will offer and what the parent wants for their family. Yep, absolutely. But let's look and see what the code tells us. So where differences of age, gender, race, ethnicity, national origin, religion, all of them, where that significantly affect a behavior analyst's work concerning particular individuals or group, behavior analysts obtain training, experience, consultation, or supervision to ensure competence or make appropriate referrals. You are not required to work with anybody. You don't have to work with any particular group. You don't have to work with any particular demand. You don't have to, but what you don't want to do is to proceed with services without looking at yourself to see, can I be objective? How will my feelings toward this group or this family affect the quality, even if you are not aware that it is, right, the decisions that you're making. But you absolutely could get some training. I mean, what culture is this? What does that mean? You know, maybe I want to reach out and see if I can learn more about a culture where males aren't caretakers, and, you know, maybe that will help. So some options here.
Doesn't the family have some choice? I mean, if they really prefer working with someone else, why not honor their preference?
I think you absolutely should if you can. And, and I'll tell you, I mean, in this situation, we were able to do that. We're a huge organization. I've got, 40 people to pick from. So, accommodating that and being respectful of that cultural preference was easy for me. But if it's me and 4 BCBAs or 4, direct line therapists in my little company, you may not be able to do that. So it's just, yeah.
I think the bottom line is you just have to be truthful and upfront with the parents. So you
Absolutely.
have to say, yes, I can accommodate that, or you have to be truthful and say, I understand your concerns, but this is, we don't have the availability of
Right.
female therapists. So.
Right. All right. Just doing a time check. Everybody's hanging with me? Okay. Jonathan is a BCBA whose aging parents are beginning to need support due to declining health. Jonathan is an only child and lives about 3 hours from his parents. He begins to spend weekends with them and attempts to get up early on Mondays to make it back to complete his work, consulting with several local schools. Over the past 2 months, he's missed 3 IEP meetings and was 45 minutes late to an in-service training he was giving out of school. What are the concerns and what should Jonathan do? Somebody new. Let's branch out. Who haven't I heard from? Okay. So one solution is reduce your caseload, refer to your colleague. What's the issue here? Right, but what's the professional issue here? He's missing meetings? Yeah. Yeah. Okay. Yeah, he's not providing the services. So one of the very first things that we talked about when we started looking at the code is that you follow through on your contractual obligations. You don't commit to things that you can't do. And so and it doesn't matter why. There's no difference whether, Jonathan is lazy versus Jonathan has this really serious family thing going on. The fact is that he's making these commitments and he's not following through. So if you look at the code here, looking at the second bullet point here, recognize that your personal problems and conflicts may interfere with your effectiveness. Refrain from providing services when your personal circumstances may compromise delivering services. This actually applies to both of the last 2 scenarios. So your personal circumstances related to maybe having a disagreement with a parent that you think is sexist, or this personal circumstance where his attention is being pulled to his parents. And so you have to recognize this and make sure that they're not compromising the delivery of services. And so some of the solutions that were generated were spot on. Okay, Jason is a BCBA working directly with a 3-year-old named Sam in his home. He has sessions every Tuesday evening. Each time he comes to the house, he notices that Sam's mom is struggling to get dinner together and the options are pretty limited. Jason decides that he'll pick up dinner on occasion and bring it to the family at his sessions. Jason just wants to help the family since he knows caring for a child with special needs can be so expensive. Is this okay for Jason to do? Why not? I love that you just said how mom might perceive that, because at the face of this, Jason sounds like an angel to me. Jason's heart is in the exact place it should be, and it's very difficult for people to understand why we as helpers can't help. But from mom's perspective, what's the problem if mom perceives that they're friends? That's right. So mom could come to rely on dinner being provided by Jason and could start to have some financial issues if she's spending her resources somewhere else. That's a possibility.
Plus, he's not helping her to deal with that issue of how do you manage all of this.
So Yeah, so there are other ways that you can be a care coordinator, that you can help them to find some supports in their community, some advocates, some funding agencies that might provide some help. There are lots of foundations, things like that.
I've had clients and families that didn't have a lot of food, and I would refer them to local food banks, help them find the resources that can support them.
Yeah, great. So referring to food banks and that sort of thing. Lots of hands on this one. Good.
Actually making the mother to be helpless rather than empowering the parents. This is our very first duty, and there are many ways as a behavior analyst we can find a solution and guide the family forward.
Okay, so potentially looking at again, the long-term effects of doing this for a family and they've come to rely on it. Yeah, that's a possibility right there, is that, you know what, I don't really love Saturday sessions, so what do you say we don't do our Saturday sessions anymore? And then this family is, now there's some sort of obligation thing going on here. That's a really awesome point.
This happened with our agency with one families that we served, and it wasn't a BCBA. They got stuck, but they did like one nice thing, and then it kind of like opened up a cycle. And so then, we had to meet with the family and kind of discuss, why we can't do this. And it was really hard because that damaged the relationship.
Yeah.
Because they viewed it as, well, now you did this for me, and now you're backtracking. And,
Yeah.
now you don't care about me. So it's really important to just never even start that, because it can quickly get out of hand.
Very quickly. Yep.
More of it possible.
I was thinking of, how does the mother feel about it? She might be embarrassed.
Absolutely.
That might be the best she can do, and she might not want it known that she can only provide, say,
That's right.
one option at meals. Or, she just might not.
Yeah. Again, a great use of empathy here. So thinking about it from mom's perspective, she might be embarrassed. This might damage the relationship in a different way, because now I know that you feel sorry for me, or maybe those kinds of things can be very difficult. What if this mom decides that she doesn't like the services she's getting, but has come to rely on that Tuesday night meal? So now she's in a situation where she continues with a service she doesn't want, because they have hunger issues, right? There's so many things here that come from Jason having one of the best hearts in the world, but can introduce serious issues. And so the idea of maintaining a professional relationship is at the base of this entire scenario and all of the negative consequences that can happen based on that. So here, multiple relationships and conflicts of interest. Due to the potentially harmful effects of multiple relationships, behavior analysts avoid multiple relationships. If behavior analysts find that due to unforeseen factors a multiple relationship has arisen, they seek to resolve it. So sometimes things happen. And when you find that you have damaged a relationship, or you find that something has happened, it's again, we bear the burden. Not the family. That's our job. This is what we agree to when we become practicing behavior analysts. So we are the ones that have to resolve these issues. This is new. That's what it says, NC, new to the code. It specifically says that behavior analysts recognize and inform clients and supervisees about the potential harmful effects of multiple relationships. So the days of simply smiling and saying, oh, thank you, but no thank you, are done. The days of saying, I wish I could, but I have a boyfriend, are done, right? The code is pretty clear here. We recognize and inform clients and supervisees about the potential harmful effects of multiple relationships. It is no walk in the park to talk about these things, but that we are... Now everyone here knows you don't get a free pass. This is our job. We have to talk about why, we've got this thing called the ethics code. I love hearing John Bailey say that. We've got this thing called the ethics code. And that's how you start that conversation. As an ethical professional behavior analyst, I'm actually not allowed to X, Y, and Z. it can't be more plainly written here. Also new to the code related to multiple relationships is now behavior analysts do not accept any gifts from or give any gifts to clients because this constitutes a multiple relationship. The old code did not say it this plainly. It was something like, if you can foresee some sort of obligation or vulnerable relationship or whatever it may be. But now it's pretty clear. And this is very, very tricky. We're going to talk about a couple of strategies at the end. Just doing a quick time check. Paul is a BCBA working in a center for children with ASD. He has a team of several entry-level therapists, a receptionist, and an administrative assistant. During the holiday season, parents always want to show appreciation for the staff. One father brings in a gift card for $50 for Paul. Another parent brings in a tray of holiday cookies for the whole staff. How should Paul respond to these parents? What ethical concerns might arise? What should he do in the future? Yeah. Yeah, so contact the parent, explain that you can't accept it. Yeah, it's awkward. Yeah. Yeah. Right. Yeah, I mean, I think here's the definition of a gift. You have to think about that. So if somebody makes a handmade Christmas card and brings it in, is that a gift? Or is it a token of appreciation? Is it an art project that they just want to share? I mean, it doesn't say it here. I think that for sure the $50 gift card is a gift. It's labeled gift card. So that's a no-brainer. The cookies for the staff, especially if you've got, we've got some ninja parents, man, they just drop it and they're out. And you're like, wait, don't leave this stuff. It's hard. And what are you going to do? Throw the tray of cookies in the trash and the whole staff's looking at you like, what are you doing? I mean, this is tricky. So certainly, I like to think about what should you do in the future. Before every holiday, we send a holiday letter. We outline exactly, due to our ethical code, we are not allowed to accept gifts. Please do not bring any gifts, and we just put it in writing, and we really try to explain it in a nice way. It really can, and sometimes we can even give some suggestions. If you want to take a family photo in front of your tree, we can share it with the staff. They can, we can pin it up and, whatever it is. And we try to give them some suggestions or, please feel free to wish our staff happy holidays when you're here, but please don't bring any gifts, whatever it is. And a lot of times our parents, when they sort of get the sense that the staff might get in trouble for accepting a gift, then, they are very much on board with that, but you still definitely have some families, they just want to bring in coffee and bagels, they want to do something. I think that certainly the statement before where you recognize and inform, you definitely have to say to the family, like, you dropped off some cookies, that was really sweet. We aren't allowed to accept gifts, just want to let you know, all of those things. But, I'm not going to get in my car and drive the cookies back to the parents' house. I mean, you've got to act within reason here. That's my 2 cents, yes. Yeah. Mm-hmm. Yeah. Yeah. This is a great question. This leads to cultural considerations. And I would love to go to a cultural considerations and ABA workshop myself because I don't think we talk about it enough. So the question here is, what do you do with some cultural, I guess, practices where giving of food is just, I mean, that is the traditional. And you're in the home, and if you don't taste it, I mean, you know, in some ways, the ethics guidelines, they often don't mesh. So if you do this one, you're violating this one. And if you do this one, you're violating this one. And so you have to think about the responsibility that you have with the client, meaning that if you engage in some behavior that disrupts the relationship, thereby affecting your effectiveness, you know, you've got to make those decisions. I'm not going to tell you sit down at the kitchen table and have the meal. You've got to decide that, but you have to weigh what the ethical guidelines are telling us that we can and cannot do, and what's the negative effect of saying no thank you versus the negative effect negative effect of saying thank you. I mean, you have to think about that stuff. And again, that's why they're not called rules, they're called guidelines. That's what I think. Yeah.
One of our, as a behavior analyst, one of our responsibilities is actually train public, to educate the public.
Yes.
So we need to tell the parents and upfront, I always do it when I start the case, what are they receiving during the gift situation?
Yeah.
Or even at UN or that kind of situation. I mean, you may do it maybe one time. I was in a situation, I never
Yeah.
eaten in off the parents' house. But
Yeah.
the thing is, I laid out at first, and also as the situation arises because of their cultural background, we have to understand empathy consent. I mean, in public education, as you
Yep.
said, there are all different aspects of the ethics codes. We have to take it into consideration as a whole.
Right.
And consistently training the families as we go along.
Yeah, so I like that point about educating, training families, and talking about it at the beginning of the relationship. And we're going to talk about some strategies to put that stuff in writing at the end. So I appreciate you bringing that up. Do you guys want to break? I'm seeing some nods. People had coffee and all sorts of stuff. Okay, so is my watch right? 10 after 10? It's 10 after 10. 10:07. So what do we, 10:15? 10:20? 10:20. Can we say 10:20? Okay, great. 10:20. Okay, guys, we're going to get started. And I was just reminded that I was neglecting our webcast participants. So when you guys are participating, I'm going to try to just quickly paraphrase so that everyone can hear through the mic. So thank you for that reminder. Okay, so it has just occurred to me that we're still in number 1, responsible conduct for the behavior analyst, and we have so much to cover. So I may be just sort of skipping around and skipping ahead, and that's okay, because I wasn't going to cover the entire code, obviously, anyway. And of course, it's your responsibility to make sure you're reading it and looking at it after this anyway. So we'll just breeze through a couple of things. The only thing I want to highlight on here are the 2 that are marked NC for the new code, because the new code has just made these 2 points a little bit more clear, that behavior analysts refrain from any sexual relationships with clients, students, and supervisees for at least 2 years after the date that the professional relationship has ended. And also there is a more specific code related to bartering for services, that we don't barter for services unless a written agreement is in place, that it is requested by the client or supervisee, that it's customary to the area, which is a nice kind of nod to cultural types of situations, and that it's fair and commensurate with the value of the services provided. So it's just a little bit more clear here. This is a little bit similar to what we've already talked about, which is that we accept clients for services that are commensurate with the behavior analyst education, training, and experience, and that if the client that you are taking on is not, then the behavior analyst must have supervision or consultation. We've already talked a little bit about that, so I won't spend too much time on that. Now, I do want to talk about, get into 2.0, behavior analyst responsibility to clients. During the break, I had a couple of questions from people who work in schools, and so I think that some of the content in this area is going to be really helpful. Responsibility, our responsibility is to all parties affected by behavioral services. And what that means is not just the individual that you're working with, but the families within which they reside, the community where they live, the school, the classroom, all of the parties who will be affected by what you are prescribing or putting in place are subject of your responsibility. But when there are multiple parties that are involved, so those of you who are working in a school system, you need to identify and spell out the hierarchy of parties from the outset of the relationship. So who's first? And the guidelines aren't necessarily telling you who's first, but you and whoever you are interacting with need to know it. It needs to be clear that, because when there are conflicts or, different parties are wanting different things, it needs to be clear who takes priority. Behavior analysts identify and communicate who the primary ultimate beneficiary of services is in any given situation and advocates for his or her best interests. So once that is decided upon, who is the primary beneficiary, that's who takes precedent. That's who when there's a disagreement or two different roads you can take, that person's best interest is where you go. Okay, so Patricia, the mother of a 7-year-old with ASD, requests intensive services at your center. After a thorough intake assessment, you conclude that a primary area of concern is social skills. You know of a wonderful behaviorally based social skills program that is offered at the same time as the open slot in your program. You feel your center can also provide or offer social skills intervention a few days a week with some other clients that might be a good enough match in your program, and you are eager to fill the slot. Plus, the parent is there seeking your services. What should you do? Okay, refer. Anybody want to just fill the slot? And you have some choices here. That's what it's sort of asking you. Okay, give her the choice. Tell her both options. Yeah, so there's some cues here, and both of those things I think are, yes?
Who's the primary? The child or the mother?
Well, I mean, I think that's a good question. Who's the primary, the child or the mother? I think that most of the time, I mean, a parent's going to be making the decision for the child where they're going to go and that sort of thing. But I think that the answer back here is, you review both. So let me tell you about the services that we have here. You're going to do that anyway. But to stop there is not really in line with the guidelines, where the responsibility is to the best interests of the clients, not the best interest of filling the open slot in your clinic. Now, that might be what you ultimately decide with this parent. That comment at the end is right. The parent is there seeking out your services. To assume that the parent wants your services over a better alternative would be wrong, but also to assume that there aren't other reasons why the parent is there. She may be seeking out your services because you're 2 minutes from her house instead of 20 minutes from her house. Those are absolutely real decisions that families make. So you don't want to make any assumptions here. You want to talk it through and make the decision for what's the best interest of the family. Here in 2.0 consultation, I want to point out what's new, designated by the NC. This is an addition. When indicated and professionally appropriate, behavior analysts cooperate with other professionals in a manner that is consistent with the philosophical assumptions and principles of behavior analysis in order to effectively and appropriately serve their clients. This was added, and I think what this what this is sort of bringing to our code that was missing before, is sort of this, well, maybe not completely missing, but not completely spelled out, is the fact that children with developmental disabilities and autism related disabilities have numerous needs. They have medical needs, they have educational needs, they have behavioral needs, they have all kinds of needs. And this is the recognition that there are multiple disciplines working with these kids at all times, and multiple disciplines have evidence-based interventions that they do. Also, other disciplines have non-evidence-based things that they do. And so when you are engaging in consultation or cooperative treatment planning or interaction for a client, we want to collaborate, we want to be cooperative, but we also need to stay true to what is consistent with our philosophical underpinnings of behavior analysis. And the code clearly defines that here. So that if you're asked to do something that is not in alignment with that, the code sort of backs you up for not doing it. Third-party requests for services. The behavior analyst clarifies to the extent feasible at the outset of the service the nature of the relationship with each party. So third-party requests or services are things like a school system has contracted with you to work with a classroom or a student, that sort of thing. And you need to talk about it up front that there are limits to confidentiality. So if a school is bringing you in and then wants to have a report on how the child is doing and the parent doesn't want you to tell them, that's a problem. You have to talk about that at the beginning, that there are limits to confidentiality. I will be making a report to the school. But you need to tell them in the beginning and not just let it arise later and then you have an issue. Behavior analysts put the client's care above all others, and should the third party make requirements for services that are contraindicated by the behavior analyst's recommendations, we are obligated to resolve such conflicts in the best interest of the client. So when you are asked to do something that is contraindicated and you work for that school, you are in a pickle. It's a problem. The code is clear here that the client's care comes before all others, and that we have to resolve the conflicts. If conflicts cannot be resolved, the behavior analyst services to the client may be discontinued following appropriate transition. So this also spells out what a course of action can be for you. If you are being asked to incorporate things into your behavioral treatment plan that are not behavioral, that are not based on function, all of those things, the code here specifies a course of action. Okay, I think for time's sake we might skip over a few of these things. Confidentiality, this is every day, constant. I think that a couple of things that I just want to talk about here is making sure, of course, that you're discussing confidentiality at the outset of the relationship, and that when you are engaging in, you're writing a report to give to a school or to, bring to an IEP meeting, or for whatever reason, writing a treatment plan for payment for services with an insurance company, that you include only information that is germane to the purpose for which the communication is made in written and oral reports, consultations, and the like. The other stuff that's not relevant is not necessary. It's not necessary to talk about some things that are not related to what's going on with the child and the family. And we discuss confidential information only for appropriate scientific and professional purposes with persons who are clearly concerned with such matters. And this is new, added, we must not share or create situations likely to result in the sharing of identifying information about current clients and supervisees within social media. So now we are starting to see in our code social media being referenced, that this is a big issue, and we see behavior analysts, and really more so the direct line therapists, kind of blurring this quite a bit. So you want to make sure that you're incorporating this into your supervision and training. Let's look at a case study. Karen, a BCBA who works with children with significant problem behavior, got a new client. During her session, the child exhibited incredibly high rates of aggression, injuring both her and her coworker. Karen had visible bandages around her left arm. At the end of the day, as Karen was leaving, the receptionist asked what happened to her arm. Karen told her about the new client and how tough the session was. Karen also said to the receptionist that you couldn't miss him tomorrow. He's almost 6 feet tall. What do you think? Any issues here? Yeah, there's potentially a confidentiality issue here. So it's kind of gossipy a little bit. There are visible bandages, so it's totally reasonable for the receptionist to ask. Completely reasonable for her to ask. Yep.
Isn't it reasonable also to tell a receptionist to watch out for somebody that might knock the hell out of her?
Yeah, so I'll paraphrase. Isn't it reasonable for the receptionist to know about this child in case the aggression were to be directed in her way? I actually agree with that too. I mean, when you first look at it, it's like, yeah, that's gossip, that's not. But depending on where you work, how these children transition in, who's there to staff the child immediately, it's possible that a small parent or caregiver brings in the child and it's just the receptionist there. There could be a better way to maybe say this. There could be a more professional, okay, this is how we address these issues with our support staff. But it's a possibility. So it's not completely cut and dry here. If there's no reason to share who the particular child is, it should not be shared. And that's the point here, is to really be clear on what we are conveying to people who are not involved in the clinical services of the kids that we serve. Okay. Let's look at another one. Sarah has been working with the family for 6 months. The family is 4 months behind on payments. Sarah has discontinued services and sent the family numerous letters indicating that their bill will ultimately go to collections if they do not settle the balance. Sarah contacts a collections agency and tells them that the family has been receiving services for their child with autism and owes a balance. Is Sarah allowed to do this? What ethical issues are concerns here? Can she do this? Tiffany? Great. So the answer is right. So you can do this. You do need to tell families at the outset of their relationship that you can breach confidentiality in order to collect payment. But you also noted that there are a couple of details here that are probably not relevant. What the diagnosis of the child is not necessarily relevant here, and no reason to share that. So it's pretty clear here in disclosures that we can disclose confidential information without consent. We do not have to ask. When it's mandated by law, so things like suspected abuse and stuff like that. But if you look at number 4 here, to obtain payment for services, we're professionals. We have to get paid. You can send a family to collections, but you cannot, engage in the gossipy part of things or provide information that's not germane to the reason that you're disclosing the information. Great. Okay, still in 2.0, clients have the right to effective treatment based on the research literature and adapted for the individual child. So when you read the research literature, it is unlikely that the person who's sitting right in front of you is exactly like the kids that are in those studies. You adapt what you're reading. That's what makes evidence-based practice. We always have the responsibility to advocate for and educate the client on scientifically supported, most effective treatment procedures. Effective treatment procedures have been validated as having long-term and short-term benefits. The thing here is that it is our burden, it is our job to advocate for and educate the families. It's not appropriate to expect a family to only come in and ask for evidence-based services. They don't know necessarily. They have what is available to them. They have what's on the internet. They have pediatricians and other kinds of first-line providers. But the things that they are requesting, and this is across the board. If you take an empathic view is that the demands that get made of behavior analysts to tweak things, to change things, oh, I don't want to use that, I don't, is not coming from a negative place, but it's coming from a place where they want to do what's going to work. And so it's our job to advocate and educate the child, the family. We also need to advocate the appropriate amount and level of service needed, and when more than one scientifically supported treatment has been established, additional factors should be considered, such as efficiency, cost effectiveness, risks, side effects, client preference, and the practitioner experience and training. All of those factors are absolutely important to weigh when you are matching what you're going to do with the family. Okay, Jake is a BCBA who specializes in skill acquisition and problem behavior reduction in children with disabilities. He's well-versed in evidence-based treatments, keeps up to date with the literature. He's working with a child who has not responded to numerous evidence-based protocols aimed at increasing his vocal language. He cannot find any additional strategies in the literature. Jack has new ideas for adapting some procedures that have been effective in increasing other skills. What should Jack do? Shrug his shoulders, go home. Try it. Go ahead, down here. Yeah. So do an assessment and evaluate whether they work. That's what we're supposed to do. Okay? Yeah. Did you want to? Yeah. I mean, certainly it's implying that he's sort of at his wit's end. There isn't any other option, but there may be, reaching out to researchers in the field. But evidence-based practice says that you take into consideration the client and the situation, the research evidence, and your own expertise and experience, and that's how you come to evidence-based practice. And one of the beautiful things about behavior analysis is that every single one of us knows how to evaluate whether something is working or not on an individual basis. And you don't have to publish it, you don't have to present it, but it can guide your practice. And that's the really nice thing about behavior analysis, is that we know how to do those designs. One thing in the Bailey and Birch book, and I'm not going to spend a ton of time on this, is that if you have this text, if you want to, nobody tells me to tell you to get this, but they do have a nice little outline on how to do a cost-benefit analysis, where you sort of evaluate the nature of the behavior being treated. Is it severe? Is it, simple? How important is it? Do you have sufficient personnel? Is the mediator well trained? Is the setting appropriate? Really to go through all of these different risk factors to determine should you try what you're thinking about trying. And then the benefits. What are the benefits to the client if it works? What are the benefits to the setting, to the caregivers? And what about the reduction in liability? So if it does work, are people safer? Things like that. It's a really nice little section of the text. So I encourage you to take a look at that. Let's try to finish up 2.0 for behavior analyst responsibility to clients. Just really quickly, documentation and fees. Nothing new really here, but that we want to sign a contract at the outset of the relationship, outlining your responsibility, and you want to specify compensation and billing right up front. Now, interrupting and discontinuing services, you make reasonable efforts to plan for facilitating care in the event that the behavior analytic services are interrupted. We can't predict the future. You don't know when you're going to fall ill. You don't know, when something's going to happen in your family. You don't know these things, and so there needs to be a plan. Who's going to take over for that 2 weeks or 6 weeks or a year or however long it is? And is your documentation in a place where people could take over? That's the point, is that we're sort of making sure that we have a plan in place so that if they're interrupted, somebody can come in and pick up where you are, or that you've discussed that with, there is nobody else, or here's a list of referrals ahead of time and that sort of thing. We do not abandon clients, so we can terminate service, of course, when they no longer need the service, if they're not benefiting from the service, if they're being harmed by the service, or if they request to discontinue. And in bold here, of course, is if we terminate, we provide appropriate pre-termination services. We suggest alternative service providers as appropriate and any other reasonable steps to appropriately transfer that care. That is a responsibility. Even if you're terminating because of lack of payment, you do not abandon clients. Now, the in-depthness of this is not specified, but you've got to do it. Okay, great. We're into 3.0. Let's do a time check. Okay, so this is new to the code. Behavior analysts conduct current assessments prior to making recommendations or developing behavior change programs. So when you think back to that first scenario of providing a toilet training protocol, one of you mentioned there was no assessment. That's right. You have to do an assessment of what's going on. It doesn't tell you what kind. You don't have to do an FA. It doesn't say that you have to do that type of assessment. You can do something less structured. That's not the point here. It's that you do an appropriate assessment. If you're going to do behavior reduction, you must first conduct a functional assessment. Again, not a functional analysis. It might be warranted, but you do some kind of a functional assessment to determine the function of the behavior. We are also obligated to collect and graphically display data. Doesn't tell you how much data, doesn't tell you how often data, doesn't tell you how to graph it, but that you are obligated to do that. This is new also, and I love this addition, that behavior analysts recommend seeking a medical consultation if there is any reasonable possibility that a referred behavior is influenced by medical and biological variables. This is crucial. There's so many things that we don't know about the human body, and with children who have a difficult time communicating, there's absolutely no reason why you shouldn't get a medical consultation if there's a reason to think that there's something that's causing pain or something that's actually the cause of what you're seeing. We get consent before we do behavioral assessment, so we're getting consent in writing before doing assessments. And we explain our assessment results. So behavior analysts explain assessment results, again, using language and graphic displays that are reasonably understandable to clients. You do not need to blaze in there with technical jargon. That isn't doing anybody favors. So you want to use language that is understandable. Let's take a look at this case study. Jim is a BCBA who conducted a functional behavior assessment for a child in a classroom as part of the child's IEP. When the IEP team is scheduling the meeting to discuss the behavior intervention plan, he cannot attend. The team asks for him to submit the report. Should he submit the report even though he cannot attend? Great. Yeah, so a suggestion to reschedule because just reading the report, they may not have the background to understand the assessment. Yep. A parent needs to be notified, and that is definitely an issue, and probably they are, but the parent is one of the people who needs to have the report explained to them, actually. So we want to make sure that we are explaining the report or the outcome of our assessments, not just submitting reports. Okay, let's do this one. I might start skipping around a little bit. The parent of a 9-year-old with autism provides a short list of preferred activities that a BCBA hopes to use as reinforcers. According to mom, the child doesn't engage with very many toys or activities. During the preference assessment and informal observations, the most preferred activities were watching Barney and other preschool cartoons. The child's mom says she doesn't want the BCBA to use them because they are not age appropriate. She only wants age appropriate activities to be used. The BCBA assesses numerous activities and videos and cannot find any age appropriate reinforcers. What should the BCBA do? What are the ethical concerns? So from a practical perspective, the answer here is start with those and shape a reinforcer, but the parent is basically saying no. So refer them to somebody else. It's an option.
Well, you can explain to the parent that that may be a starting
Yeah, so explain to the parent that we would start with this and that their parent's goal is a good goal to have. Okay? So introducing new age-appropriate activities along with these. You guys are all behavior analysts. You know how to solve this problem. The parent doesn't know that you know how to solve this problem. The parent doesn't even know that there is a problem. And so the issue here, of course, is that without functional, potent reinforcers, we're going to have a hard time teaching anything. And so a lot of the solutions that you guys generated are certainly things that are going to get at the parent's concern, but the first concern is talking with the parent about evidence-based practice, using scientifically supported interventions, and what your ethics code sort of says about that. So behavior analysts design behavior change programs that are conceptually consistent with behavior analytic principles. So starting to work on language skills or behavior problem with no identified reinforcers doesn't fit here. The parent doesn't know that. She's being demanding, maybe, not really though, she just doesn't know, right? So it's setting up an issue, but potentially not one that can't be overcome. We also are obligated to describe conditions for program success. So the parent doesn't know that this is going to be an issue for program success. So what are the conditions that are necessary for a program to be effective? Potent reinforcers, we all know that, right? But she doesn't necessarily. So the code gives us some ways for us to talk through this with the parent and to set a long-term path. But in the end, we're also obligated to provide effective treatment. And if the answer is no, you can't use reinforcement, then you have a conversation about, then I don't think what you want is ABA, right? So let me help you figure out what you want. Okay, let's see. We are going to skip over that one. In the same line, we identify environmental conditions that interfere. So what would prevent implementation of behavior change programs, and we recommend professional assistance be sought if we can't overcome those things. So are there things in the environment that are going to prevent us from being effective? It could be that you need an additional set of hands in a classroom. There are lots of things that can be a problem that we can then request other professional assistance. And we need to discuss things that will hinder implementation and seek elimination of those environmental constraints. And that's a process. You work with the environment, you work with the family, the teacher, whoever it is, to eliminate those constraints. And oftentimes that's through a rational, productive conversation that involves education, right? Okay. Sam is an 8-year-old with autism. He's minimally verbal and engages in a lot of repetitive and stereotypical behaviors. At times, he becomes disruptive and makes messes throughout the house. He's also not toilet trained. After a thorough assessment, a goal meeting is scheduled to discuss a comprehensive plan with the family. At the meeting, the parents indicate that one of their top priorities is to teach Sam to wear a yarmulke in accordance with their Jewish faith. The BCBA is stunned that this would be a top concern given all of Sam's other issues. How should the BCBA respond? She should teach him to wear the yarmulke. Okay? Yep. Yeah, I like to put in those little emotional words because we're human beings and you really want to get good at looking at yourself. When you are having any kind of emotional response to try to figure out what it is. A lot of times when I give this presentation, we talk about this scenario, and there are several people in the audience who don't understand this. And that's okay. There's nothing wrong with that, unless you don't think about why I don't understand this. Why would this be a top priority for this family? So Beowulf and Risley in 1968 tells us that behaviors that are targeted should be socially relevant. Not to me. It's not socially relevant to me as the behavior analyst. It's socially relevant to the person I am tasked with helping. That's who matters. That's whose community matters, whose value system matters, whose life they have to live. It doesn't, I'm not Jewish. I don't really know that much about it. But I'm not going to put my system of values and beliefs on top of or over a parent. But there are lots of things in our ethics code that can guide how we then proceed with that conversation. We can talk about the effectiveness of a program. He has a lot of needs. If we put this on the list, what does that take away from? So that they're aware, okay, we're not going to be able to spend as much time on, the destructive behavior that happens at bedtime, because we're going to carve out a little bit of time. Is this something you still want to do? We're going to describe the conditions that are going to hamper intervention on other things. And in the end, what's socially valid for the family is what we're going to be working on. So we want to choose targets that are important to the child and the family that will help the child achieve the most out of their life. And our job is really to talk through those goals. Yeah.
Something like that is important to the family, but we're definitely not doing things that, like, if, the behavior, maybe say skimming for self-soothing, that's not disruptive to any, task or anybody else, but the family says it's just a way and they want it to stop. Something like that is kind of unethical because that's how that young person soothes themselves. Stuff like that kind of backs you into the wall sometimes.
Yeah, I like that comment about, the things that, so parent preferences, this is a parent preference, but in the grand scheme of things, there are lots of parent preferences, and some could be viewed as, why are we going to work to reduce this stereotypy when it's not causing any harm and, whatever it is. And a lot of that happens through education and training. But again, that's just something as a practicing behavior analyst, you have to make the decisions on that. What I want to highlight here, of course, is that we're not jumping to any kind of situation or decision that's based on our personal values as opposed to theirs. Yeah.
I think, looking at the ethical code, sometimes they make it very easy for clinicians to say, I need to walk away or I can't do this. But I try really hard to look at the implications of that as
Yeah.
well for a family to hear a behavior analyst say, I need to back away and I can't help you, is also sometimes unethical. And you have to look at ways to use your ABA principles. Sometimes you have to back up.
Yeah.
Sometimes you have to work with the family to help them understand it, or seek other areas of expertise or whatever. But
I love that.
the ethical code is an excuse to
Yeah.
say, I'm out.
I love that point, that the ethics code gives you some outs. It absolutely does. You don't have to work with certain families. You don't have, it gives you some outs. One of the reasons why when I talk about ethics, I like to talk about empathy so much, and I hope y'all don't mind me bringing it in, is that I think that helps you when you focus on what is the perception or perspective of this family, helps you to dig in as opposed to step back. And yeah, we may be starting at a place that I'd much rather just be given whatever you think, you're the expert, do it, that sounds great. And you just go in and you design an awesome program. And when that doesn't happen, instead of bailing, saying, okay, we're starting 6 or 7 steps back, educating, advocating, building the relationship with the family, working with them, all of those things to get to the point where you can design a great program. And I think that's one of the reasons why I like to talk about seeing it from their perspective, is that they're making crucial, tough decisions for their family, and it all comes from a place of wanting to help their child. And our job is to teach them that the best way to help their child is to do evidence-based intervention. And just because they don't agree to it right off the bat doesn't mean it's a lost cause. It just means that your job has changed. You just start from a different place. So I really like that comment. Okay, so let's see. Let's move into 4.08 on punishment. Of course, this is not new. We recommend reinforcement rather than punishment when we can. If punishment procedures are necessary, we always include reinforcement, but there are some new things under here. New to the code, reinforcement-based procedures are implemented first unless the severity or dangerousness of the behavior necessitates immediate use of aversive procedures. This is brand new. So this, and I think speaks directly to severe behavior issues. And they go on to say here, aversive procedures are accompanied by an increased level of training, supervision, and oversight. Behavior analysts must evaluate the effectiveness of aversive procedures in a timely manner, not every 9 weeks, and modify the behavior change program if it is ineffective. Behavior analysts always include a plan to discontinue the use of aversives. So these two things are new to the code. I think it's a great addition. It gives, I think, some clear guidelines here, and also speaks to the level of expertise that needs to be involved. Avoiding harmful reinforcers, we're probably going to skip well, I'll show you a little bit of this. Avoiding harmful reinforcers, nobody really talks a lot about this that I know of, and I like to bring it up. The code says that we minimize the use of items as potential reinforcers that may be harmful to health. And it used to say in parentheses, for example, cigarettes, sugar, or fat-laden food. That has been removed in the new code, but I like to bring that up, that's kind of what we're talking about here. And some things are pretty obvious. I mean, you know, there are things that are harmful, but some things I think we sometimes implement without a lot of thought. Because we are oftentimes trying to find the most useful, most potent reinforcers, because we have a huge task ahead of us in the things that we are trying to teach and reduce and manage in the individuals that we serve. So I just want to bring this up because a lot of people do use edibles in their programming. I do. And I don't necessarily think that there's anything wrong with it, but I definitely think that you should be very cognizant of what you're deciding to do. Some studies have found that repeated exposure to energy-rich food may be associated with an increased obesity risk, and that the delivery of high-calorie foods might result in changes in food preferences over time. So as you are, you have access to and are experiencing high-calorie, sweet food, potentially your taste buds are changing. You want more. Brain imaging studies in obese and overweight humans have shown changes in the dorsal striatum indicative of reward hyposensitivity, the net result of which may be increased seeking of palatable foods. And we now know that children with autism spectrum disorder are at an increased risk for obesity, that current estimates it's been estimated that the odds of obesity and ASD are 1.42 times the rate of typically developing peers, and that should not be taken lightly given what we know about the medical and long-term effects of obesity in terms of diabetes and all the other health effects that could be going on. And now, of course, it's probably a combination of what we're eating. We know that individuals with autism can have selective food preferences. It's not just because we're using M&Ms during therapy, and maybe a little bit more sedentary. So there are lots of things going on here. But just something to keep in mind when you're programming. I'm going to show you some data. This is a little girl, well, I say little, this is weight in pounds. She was followed by our feeding program, who has started to do some work looking at risk of obesity in kids with ASD. And at 6 years old, she weighed 80 pounds, and in less than a year, she was almost at 100 pounds. So the trajectory here is not looking good. She's at risk for some pretty serious health issues if this continues. We began a healthy reinforcers change with her, and pretty rapidly. It included several things. Not only did we make changes in the portion sizes in conjunction with our feeding program and the types of things that we were offering, we also did education with the family in the home. So there's multiple things going on here. They were changing their food preferences at home as well. But when we made this decision to alter the reinforcers that we were using, we wanted to make sure that we were not seeing any negative effects on how she was doing behaviorally. So I'm going to show you just some day-to-day data, nothing special here. We just were tracking the average rate of MANs or requests in the dark data path, and open data path is just her average rate of combined inappropriate behaviors. And what I want to show this for is to see if you can figure out when we made the shift. Is there a drastic change somewhere? Did Manding go in the toilet? Did problem behavior shoot through the roof? Not really. And we wanted to make sure that that was the case, that we were still using reinforcers that she liked, that she would ask for, and that could be used to manage behavior. She always has had variable, inappropriate behaviors and maintained some pretty good manding here. So it's not necessarily clear that there's any deleterious effects of making these changes. Over time, and again, nothing super special about this, these are percentage of transitions with problem behavior, and when you've got a kid who weighs almost 100 pounds, problem behavior on transition is extra special. It is hard. So we were looking at transitions with problem behavior here, and you can see over time we really did not have a problem with this starting to reduce quite a bit. This is a crazy graph, and again, this is just pulled from a chart here. This is an intensity rating that my therapist filled out after every transition because I wanted to know how hard it is. And you can see at the bottom, a score of 1 means no problem behavior occurred. Number 2 is that they had to use a C grip to kind of get her up and get her going. 3, they had to use a basket hold. 4, it took 2 therapists. And 5, it took 3 therapists to get this kiddo going. And you can see by the end there, in the last month of her intervention, we were having no problems here whatsoever. And so I'm only saying this that if you want to take a look at starting a healthy kick in your programs, that you want to make sure that you're monitoring the effect that that's having on behavior. But for kids who are at risk for obesity, it might be worth thinking about this and leaning on your ethics code as to what the decisions that you're making in your clinical practice might be doing to other aspects of the whole human being that you're working with. Okay, here we go. Kelly, this is an easy one, I think. Kelly, a BCBA, is called in to consult with a school regarding the loud, stereotypical vocalizations of a student that disrupts the other students and is irritating and causes headaches in the staff. The staff would like to move the student to an isolated classroom so that the other student's work is not disrupted. Further, they have found that if he listens to music on headphones, he's quiet. Therefore, the staff have been leaving him in headphones all day. What ethical guidelines apply and what are the next steps? What comes to mind, you guys in schools? Okay, so headphones and sitting away from the others is not providing service or education, I guess. Yep. Yeah, great point. So no real replacement behaviors happening here. You're not teaching anything to replace it.
I would try to work with the staff and tell them that really their behavior is being reinforced by his absence. So essentially we're not reinforcing or repeating behavior, we're just reducing the behavior in a way that benefits them.
Yeah, so here the people benefiting are really the classroom teachers here. And there are some little cues in here that are sort of telling you. And one of the biggest issues here, I think, is that we can look to, one, there are several ethical things going on here, is the least restrictive procedures and least restrictive environment. That the behavior analyst reviews and appraises the restrictiveness of alternative interventions and recommends the least restrictive procedure. So being separated into another room with what seemingly is no assessment or attempt to teach an alternative, putting him in headphones seems pretty restrictive. So all of these things, I think, lend to this code. Okay, let's see. We are into 5.0. I'm not going to spend a ton of time on this. This is related to training programs and supervised work experiences. So how many of you, do a lot of you have students or trainees? I know some do. Okay. Yeah, so these have not changed a ton, but that we seek to ensure that the programs are competently designed, provide proper experiences, excuse me, and meet the requirements for licensure or certification. So let's take a look at this guideline or this case study here for those of you who are supervising. Dr. J is the director of a large organization that provides ABA services to children with DD. In addition to supervising employees, he often takes trainees who are attempting to fulfill the supervised work experience requirements. Dr. J has 2 trainees who spend 80% of their time in direct service delivery with clients. Dr. J has not had time to observe his students in the last 6 weeks, but he's provided phone and email consultation and plans to make up missed supervision time. Any ethical concerns here? He's not doing his job. And what is his job? Yeah. Yeah, great. So all the things that are being missed when you're not doing observation and the requirement that you provide observation as a supervisor. That's right. Did I say another? Yeah. Awesome, great. So starting to pay attention to the fact that 80% of their time is with clients, and the guidelines say 50% in direct and 50% in indirect. Now, it's not a straightforward ethical violation here. We know that supervisees need, over the course of their entire supervision experience, it has to even out to 50% direct, 50% indirect. So it's okay that there's 80% direct right now, as long as over the course of their supervision it evens out and that they're doing indirect work more heavily a little bit later. And some people are not aware of this change, but as supervisors, we all need to be aware of this. And if you don't read the newsletters that the BACB sends, I highly recommend that you read the newsletters. This is just awesome information and helps keep you up to date with the changes that are going on. So here again, the 50% maximum doesn't apply to each supervision period. It just has to be over the course of the entire training. Yeah. I think the question is, can you provide BCBA supervision, supervised work experience supervision to employees that you're paying? Yes. I don't think that there's any limit to that. There's no issue with that. Okay. Yeah.
I know that they don't talk about that specifically, but I think it's an issue of dual relationships, because when you're supervising an employee, you may have issues that are related to that employee and the job they're doing for you, as opposed to what they could be doing to becoming better behavior analysts and students. So the question, I think everyone does it all the time.
Yeah.
But I think it's something to be thinking about, because it may be that for the student's best interest to become the best behavior analyst, you might suggest something different than what you would suggest to them as an employee.
Yeah, I really like that comment. And for those who maybe didn't hear, is that there's a potential for a dual relationship, and the expectations, job requirements of an employee may be different from what should be offered to make the best BCBA that you can. And I think that definitely should be discussed at the outset of the relationship, how the two, mesh, how they don't mesh. One of the things that we do, or we've done in the past, is specify in our contract a certain number of hours that at a level you're allowed to do, and then at that point you've got to get promoted. I mean, you've got to do something different, because you can't become a behavior analyst if the only thing that you've done is line therapy. I mean, it's hard. So I appreciate that comment. Okay. So just really quickly, providing feedback to supervisees, behavior analysts design feedback and reinforcement systems in a way that improves supervisee performance, and we provide documented timely feedback regarding performance to the supervisee on an ongoing basis. So it's pretty clear to see how behavior analysis applies to shaping and behavior change for your trainee, and that you should be using reinforcement-based procedures and making sure that their performance is improving and changing over time, and acknowledge your shortcomings in that, if they are not, and what is it that you're doing as a supervisor or could be doing as a supervisor to improve that. Okay, so this is here because it has been removed. 6.0 is used to be behavior analysts in the workplace. This does not exist in the new code, so we're not going to talk about it. There's a new 6.0, so it's just been kind of reorganized from here. This used to be 7.0. Ethical responsibility to behavior analysis, and I'm going to breeze through some of this stuff just because I want to get to the communication skills and things like that at the end. Affirming principles above all other professional training, behavior analysts uphold and advance the values, ethics, and principles of the profession of behavior analysis. I was asked during the break, what if I'm dual certified? First and foremost, you are a behavior analyst, is what this is sort of reading to me. Behavior analysts have an obligation to participate in behavior analytic professional and scientific organizations or activities. So being here and participating is exactly what you should be doing. This is new to the code, promoting an ethical culture. Behavior analysts promote an ethical culture in their work environments and make others aware of this code. So this speaks to that earlier point that I made, that we have an obligation to recognize and inform individuals of ethical violations and things like that. This is exactly what this is saying here. Ethical violations by others, we first determine whether there's a potential for harm, a legal violation, or a mandatory reporting condition. If a client's legal rights are being violated or potential for harm, you must take the necessary action to protect the client. There's no question about that here. However, informal resolution is the first step if you can do this. Behavior analysts attempt to resolve the issue by bringing it to the attention of the individual, documenting their efforts to address the matter, and if the matter is not resolved, then you report the matter. So you don't immediately go to reporting, if possible, is that you try an informal resolution first. And if it meets the reporting requirements, you can submit a formal complaint. Okay, into public statements here. This causes some people some stress, especially if you have a website that supports your business. Public statements include, but are not limited to, paid or unpaid advertising, brochures, printed matter, directory listings, personal resumes, and CVs, interviews, comments, etc. This all is public statements. We do not make public statements that are false, deceptive, or misleading. I won't go through all of this, but and we claim as credentials for their behavior analytic work only degrees that were primarily or exclusively behavior analytic in content. We do not implement non-behavior analytic interventions as behavior analysts. Non-behavior analytic services may only be provided within the context of non-behavior analytic education. So if you're a classroom teacher and a behavior analyst, non-behavior analytic education, formal training, and credentialing. So you can be dual certified and you can do other types of things, but not in the context of a behavior analyst. Such services must be clearly distinguished from behavior analytic practices, the BCBA certification, and they suggest this disclaimer: these interventions are not behavior analytic in nature and are not covered by my BACB credential. This is in the code. Please feel free to use it if you are dually certified. Okay, we do not advertise non-behavior analytic services as being behavior analytic. It has to be crystal clear that there's a separation there. We do not identify non-behavior analytic services on bills, invoices, or requests for reimbursement. So it's very clear here what you can and cannot do if you work at, an eclectic kind of a situation. And we do not implement non-behavior analytic services under behavior analytic service authorization. So if the insurance company says, yes, you can do behavior analysis, we're covering this many hours, it should be behavior analysis and behavior analysis only. Okay. Whew. Got a few things to cover here. Public statements, statements by others. So I work in a place that has a marketing department. They are not behavior analysts, and they have not read my ethics code. But behavior analysts who engage others to create my public statements, to create my website, to do all of those things, I retain professional responsibility for such statements, and I make reasonable efforts to prevent others from making deceptive statements. Take a look at this. Language and learning clinics. That's what I run. This is what our marketing department came up with. Approximately 63% of children are non-vocal at admission. Of the children treated, 100% acquire functional communication. Technically correct for the year of data that we looked at. What does it imply? What statement is being made here? There's a difference between non-vocal and functional communication. This is implying that if you come in non-vocal, you're leaving talking. That's how I read it when the marketing department put it on my desk. And I was like, oh my God, please do not put that on the website. That is not right. And it's my responsibility. I have to review this stuff. I have to educate them. They want the numbers. They want to be able to say, you know, these things. And they're not behavior analysts. So we're responsible for that and what it implies, what a lay audience will take from the message that you're saying. Let's see. Okay, you are a highly respected clinician and prolific researcher. A client contacts you for services, but your caseload is full. In your attempts to provide other resources and referrals, you come across a website of a provider that states he was trained by you. You have never had this person as a student or employee, but your professional workshop registry shows that the person attended a 2-day workshop that you gave about 6 years ago. Is there an ethical concern, and what should you do? What's the concern? False statements, right? So what's your obligation here?
First, he could have been sleeping the whole 2 days.
Yeah, I mean, I don't think anybody would argue that sitting through a 2-day workshop doesn't mean you were trained by somebody. That implies, you know, you can list some training activities that you've done, but saying, oh, my mentor was, you know, Alice Schillingsburg or whatever is a stretch for sure.
I think the first obligation is to reach out to the person, explain what your concern is, and then, you know, put it out there that I'm asking you to remove that statement. It's not, you know, that wasn't the intention of the 2-day workshop. Then you have to follow up to see that they've actually done it, and if not, then you have to go to...
Perfect. So an informal resolution. You must recognize and inform the person. So you have to let them know that they've engaged in an ethical violation and then follow up to make sure that it has been resolved or reported. And I think it's really important that we think about how do we feel about this person, taking credit for that, blah, 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 and doing all this stuff. Empathy plays a role here on how you address this conversation with this person. Probably, maybe they don't know how it's coming across. You know, not everyone has strong mentors who walk them through ethical situations all the time. So coming at them in a place of, hey, you know, I just happened to notice this and I wanted to talk to you about my concerns can really be a helpful thing to do. And, you know, you don't want to just go straight to the board. Like, here's this ethical violation, and then they're in trouble. Okay, so let's talk a little bit about technology, telehealth, and social media. What's really funny is this is what we thought it was going to look like, and that is totally what it looks like. So telehealth and the use of technology is among us. How many of you are doing any telehealth consulting or service providing? A little bit. Good. Awesome. That's cool. Well, I mean, it has a real opportunity to extend our reach. Let's take a look at something related to technology here. Adam needs to get a report to a parent prior to an IEP meeting. However, they do not have a meeting scheduled. The parent has asked Adam to email it. What concerns should Adam have about emailing the report? What should he discuss with the parent? And are there alternatives?
There are alternatives. I do it in my practice. There are ways that there are HIPAA compliant products that you can purchase. This is what I do in Untitled Chapter. And you can actually send the documents. It's all compliant.
Yeah.
And also the parent training I just had 2 days ago. There was a very critical issue with the parents I needed to discuss, and I set up the teletherapy meeting, and it's resolved instead of stopping both therapy.
Great. So the points made here were that there are products available that can ensure HIPAA compliance, and whether it's via email or whether you're doing teleconsultation. We're going to talk about a couple of those. My organization has a fancy button at the top of my Outlook that says encrypt. It's the easiest thing in the world. I absolutely love it. But some don't. And you can purchase things like Data Motion. I have no affiliation with this company. I actually don't even know how it works, but I do know that it exists. This is what we used to use before our IS&T department put the fancy encrypt button. But Data Motion can encrypt messages so that you can send and receive reports and things like that. So something to look into if you're doing a lot of that. The recipient just receives a notification that they have a encrypted email. They log into, they follow the link, log in, and there it is. It's great. Okay. Excuse me. Terry is a BCBA who supervises services in a clinic and home-based program. He frequently requires his staff to take video of sessions to discuss in supervision. His staff take video using digital cameras, smartphones, and tablets. Is this okay? What precautions should Terry be taking for the different methods of video capture?
It's not okay to everyone to take it with their iPhones or the devices they have, because then you cannot keep it confidential within your organization. Dedicating one person to one device or something like that.
So some concerns here with confidentiality, taking your own smartphone and not ensuring that that is kept safe and secure. Yep. Yep, parent consent, of course. So yeah, that's a really great point. I didn't put that in there. We'll assume that maybe you've gotten the consent, then, and really I think the concern here focusing on the methods of taking that video. So right off the bat, digital cameras are difficult because you can't password protect them. So if anybody here took my phone right now, first of all, I'd be very mad. But secondly, you can't get into it. It's password protected, and my organization puts AirWatch on all of our devices and tablets, which means it can be immediately disabled and wiped as soon as I report that it's missing. And so there are products available. Some companies can just can give out phones and tablets, and then it's not the staff's personal one. You can require those passwords. Mine, AirWatch, also makes me change my password every 60 days or something insane. But personal phones, it's hard to do that with your staff. But if you have them download AirWatch, now all of this stuff comes with a cost, and so you have to factor that in. But when you're talking about sort of HIPAA compliance and those sorts of things, that cost is necessary. So right off the bat, digital cameras we've phased those out completely for years now. We don't use them at all. But smartphones and tablets, all of our staff have those and are HIPAA compliant through the use of this AirWatch technology. So I just wanted to mention that things are available if you're looking at branching out into that. So telehealth, I'm not going to go into a ton of, I have a lot of stuff here. It's in your handout if you want to look at some of these articles. In general, the World Health Organization has identified that kids with autism don't get the services that they need. There are not enough providers, and this is especially problematic in rural and sort of poverty, remote location areas. It is a significant problem. So the scenario where there wasn't another BCBA for 100 miles is not, false. I mean, I live in Atlanta, Georgia. There are BCBA providers everywhere, and that's great, and lots of people live in situations like that. Other places are not that way. And so telehealth can really represent a way to remove that fiscal burden of traveling to remote areas, school systems that don't have the funds to pay for your drive time, your overnight stay at a hotel. All of those things can be remediated with telehealth. And this just involves the application of communication technologies via computer-based video conferencing. I'm not going to go through this meta-analysis. Generally, the outcome is there aren't enough studies yet to say this is truly evidence-based, go forth, but there's preliminary evidence supporting this, and it's particularly coming out in behavior analysis. And so telehealth for expanding the reach of early autism training for parents came out in Autism Research and Treatment. A couple of others here doing some really nice in-home FCT through telehealth. Dave Wacker's group actually just had a big paper come out in Pediatrics, which is a huge mainstream journal. So it's really starting to get out there and be recognized as a way to supplement services. It could be that this is how you're providing, the weekly or every other week consultation, but you still go to the home or go to the school quarterly or whatever it may be. But just something to think about. Some considerations are the equipment requirements. Bandwidth requirements reduce the quality of transmissions. I will admit I have no idea what I just said. I don't even know what bandwidth is. But it's really important that you educate yourself on this kind of stuff. And the issue with access to providers in rural areas, they also experience issues with the internet. Right? So there are, so even though this sounds like a great solution, it may not be. So there's lower internet speeds, that sort of thing, and you need to have a backup method, the phone. Then you're also talking about access to computers and a whole host of things. So it's not a immediate fix, but something to consider. Now, HIPAA applies here, of course. This requires safeguards to ensure the privacy of anything transmitted electronically. One thing that you can do is use a virtual private network or a VPN. That's something to ask about at your company. And you can also use HIPAA compliant systems, for example, WebEx. There are a few that are HIPAA compliant. Some people use Skype. That's not. But again, it goes to consent and making sure everybody is aware. But if you're looking to use something that's HIPAA compliant, we use WebEx. It's not without its issues, but it also has been really great. I wish I had on the tip of my tongue the name of the other thing that we considered. I can't remember, but yes, that's exactly what it is. What is it? VSEE? VC. That is so what it is. I'm glad you're here. It's another alternative to WebEx. It's a HIPAA compliant, kind of like a go-to meeting almost. It's where you can connect and they can connect, and then it's HIPAA compliant. Yeah. Okay, so informed consent. This is in your handout. This is an example of a specific telehealth consent that we use, and I know it's teeny tiny, so I'll just show you the areas that are highlighted here. It has been explained to me how the video conferencing technology will be used to conduct a visit. I understand this visit will not be the same as an in-person visit due to the fact that we are not in the same room with the healthcare provider. It's in there. We're going to make sure that we understand what the word telehealth means when families are consenting to services. I understand there are potential risks to this technology, including interruptions, unauthorized access, and technical difficulties. I understand that either the healthcare provider or I can discontinue my telemedicine, telebehavioral health visit if it is felt that video conferencing connections are not adequate. And then here it says, I understand that it may be necessary for others to be present during the visit other than my child's healthcare providing team in order to operate the video equipment. So we might have to call IS&T. So if we're experiencing tons of difficulties, and we want parents to know that, our ISNT guy might come in and help us because there's a confidentiality issue here and we have a specific consent form for this. If you're thinking about this area, think through that. Feel free to use some of the terminology that's in this. It's in your handout. And if it's too tiny, just email me. Okay, let's see. We'll do this one because it's social media and we haven't really talked about that. Jane logs into her Facebook account and sees a friend request from the parent of a 4-year-old child she served about 6 months ago. The family discontinued services due to transportation and other logistical reasons. Jane really liked the mom, thought it would be fine to get to know her personally. What should Jane do? Is there any ethical violation with becoming friends? They terminated services 6 months ago. Well, 2 years if they're going to have a romantic relationship. That's clear. Yeah, good question.
It would still be really tricky because that new relationship, that parent is probably going to seek advice. You have to be really careful to say, I don't want to talk anything about your child's care.
Yeah, it's a possibility. I mean, they terminated for logistical reasons. She still needs services. She just can't get there. So maybe we become friends and I can just get some advice on bedtime routine. I can get some, I don't know. We don't know. I think it's tricky. The guidelines are not crystal clear on this. This is a situation that you have to weigh the pros and cons and always remember that it is our burden to be the best that we can be. It's not the family's job to determine whether there's a dual relationship. It's yours. That's what you agree to when you go into a helping profession. So if you want to have another buddy, okay, you've got to decide, is the potential for harm, I don't know. Yes?
We do not abandon the clients. We can terminate the services. It happened to me like 12 years ago. I had a family I served. Everything was working very nicely, and I had to move
Mm-hmm.
from the area, and I transfer all my services to my colleague and transition in a 3-year period.
Mm-hmm.
And after everything was done, I started receiving requests to be a face friend.
Yeah.
And I did not, and I explained the reason is a professional relationship.
Yeah.
And what happened was 2 years after everything was good with the family, and the child progressing and everything, they took another provider, and everything went downhill.
Mm-hmm.
The child for the family, because it was not implemented correctly, they actually requested my services
Yeah.
again, and I stopped.
This is a great story. So for those of you who couldn't hear, just to paraphrase, services discontinued, successful transition to another provider, Facebook friend request that you turned down, and then when things went south with that other provider and they're looking for a provider again, they reach back out to you. And that's what happens. So to me, on the safe side, I'm a decliner. But just wanted to walk through that one. Okay, let's just go through last one, and then we're going to talk a little bit about how to approach ethical concerns. 10.0 is the ethical responsibility to the BACB. Truthful and accurate information provided to the BACB. That means keep up to date on your profile. Even your address should be right. Timely responding, reporting, all of that within 30 days. Okay, Cheryl is super excited about completing her supervised field work and her required coursework. She is scheduled to sit for the certification exam in 3 weeks. She's already found several job ads she's interested in. In her application, she included her cover letter indicating that she is BCBA eligible and is most interested in working as part of a team with other BCBAs for a strong community of professional growth. What's the problem? Well, she might fail. I see a hand. Yeah? That's right. So you shouldn't be making reference to that you are associated with the BACB until you are certified. That's exactly right. So saying the term, using the term BCBA eligible is the issue. And this is at bacb.com, BACB eligible or BCBA candidate, BCABA pending. Any similar designation is not permitted by the BACB. Individuals who have not been certified are not permitted to represent affiliation with the BACB or the BACB credentials in any manner. This student does not know. She has no idea. And so it is our job to tell her, right? So even if I'm not hiring and I read that cover letter, I don't just put it in the trash can. I pick up the phone and I call the student and I say, hey, I got your cover letter. I'm super excited that you're excited about this new career and all this stuff. I noticed something that I wanted to have a minute to talk to you about. And I take care of it. It's required. We have to do that. So we have to discourage or educate in that manner. And, you know, the lack of the awareness or misunderstanding the code is not a defense in and of itself. Okay, so the last 20 minutes, yes. Sure. Yeah, great questions. So questions related to if a parent, yeah. So I did skip past a few things you noticed. We're running out of time, sorry. I will just address it though, absolutely, for people who are wondering. So the first question was parents wanting to talk to previous parents to see did they like their the services. I've never been asked that before, so I don't know what other people do. It seems like that would be, I'm not really even sure about the confidentiality and then the request for that and all of that. Thoughts on that?
Well, my first concern is you could be cherry picking. So you could ask families who are happy with the services. I mean, most
Sure.
of us would do that kind of like job references. You don't choose an employer who hated you.
Mm-hmm.
The other concern is the confidentiality, but I think a workaround, in outpatient mental health, we send out satisfaction surveys.
Oh yeah, great.
And you can get them online, you can divide your own based on what you're doing. People can confidentially fill out the survey.
Yeah.
And then send it, and then you would have data.
Yeah, absolutely.
What your success rating or your, satisfaction rate.
Great. Thank you for that contribution. So yeah, so having more of an anonymous satisfaction survey. Super. The testimonials thing, again, if you don't read the newsletters, I strongly encourage you to read the newsletters because the BACB sends things out to clarify ethics stuff all the time. It's really helpful. Testimonials was a recent one that came out. And it does say now that you do not solicit testimonials from any current clients, that you don't do that. And previous clients, you do have to say whether it was solicited or non-solicited, that you need to make that clear when you use it. The BACB sent the newsletter out and sort of clarified that what they meant was related to trying to drum up business, but that they don't have any intention of limiting parents talking about their services and that sort of thing for general autism awareness. So this happens with us a lot during Autism Awareness Month. They, a marketing post things that says, hey, it's Autism Awareness Month. We get lots of media requests to talk about autism, and it's not really in relation to my company. It's like the local news just wants to talk to a family, and families can say, yeah, I want to do that, or no. And the questions aren't about, tell me about your services at Marcus. It's, tell us about autism. And so I suggest rereading that newsletter. It clarified that quite a bit, but not soliciting from current clients is pretty clear in the code. Okay, so we now know the code. The question is now, what do you do? We know the code, and we also know when we face an ethical issue, we have to address it. That's the most challenging part, in my opinion, because ethical situations can cause people to have heightened emotions, and we do the worst job at really dealing with any situations when we're feeling heightened emotions. So knowing the ethics code gets you only so far. We want to know how to approach and resolve ethical issues with, and doing so involves another set of skills. We don't want to be like this, deer in headlights in the face of ethical issues. So I want to cover how to address situations that are ethical issues for you. How to address situations that require confronting somebody else about an ethical issue, and we'll talk about, and frankly, the strategies are very similar. First and foremost is know the code. As it says in the code, not knowing the code is not a reasonable defense. So if you are engaging in unethical practices and you say, oh my gosh, I didn't even know there was a new code in January. Well, now you've got two ethical problems because you don't know the code and you're required to know the code. So there's no better way to anticipate and plan for ethical issues than to know the code. And it's not if, it's when. I would say a good 70% of the scenarios we talked about today have legitimately happened to me over the career of my last 10 years of being a behavior analyst. And I have handled them on a range of probably pretty poorly to doing pretty good now, and it's taken a lot of practice. Getting good at resolving ethical dilemmas takes practice, and I think that that's one of the things that I like to talk about sort of the most. Again, leaning on the Bailey and Birch book, they've got some really nice examples and resources in there. If you can borrow it, great. If you want to buy it, great. Yeah.
2 years ago, they were here, and so their whole presentation, their 3-hour presentation, is archived.
Oh, great. Thank you for that piece of information. So if you want to go back and look at that presentation, it's archived. Perfect. So they talk about a declaration of services document. I use a different term for that in my practice, and I'll show you an example of it. Essentially, this declarations of services document is a written document. Put it in writing up front at the outset of your relationship to describe these things. Upfront information helps remove situations that are going to come up, or at least give you something to refer back to when they do come up. Hey, remember that time we reviewed that document and you agreed with everything that was in there? In the services document, put in your expertise. What do you do and what don't you do, right? So when they start asking you to do these things, you say, remember that time when I said I'm a behavior analyst and this is what the services are? And then you can really start to talk about, if you want to get services related to this, let me give you some ideas of where you can go, but I don't do that. List your credentials, talk about a professional relationship and what the limitations and risks are. I'm going to show you some examples in just a second. What do I do? Explain the behavior analytic approach. Take a few sentences to explain what it is and how I work. That you should be fully expecting assessments, database decisions, how do we handle termination, put all of that in there. What are the client responsibilities? They should not be hearing in your first parent meeting that they're supposed to be doing some stuff at home. You describe that I expect parent involvement and you to participate in parent training and for you to take data before you even start the relationship, so that later when they say, no, I just thought I was bringing him, I didn't know I was, that will head that off later. We talk about the code of conduct. We give them a link to our ethics code so that they can look at it if they need to. We talk about confidentiality, appointments, fees, emergencies, all that stuff. So here is our consent for behavioral assessment and treatment. And again, it's super tiny. It's in your handout. I'm happy to share this with you. But we describe, I understand that my child will receive behavioral services as an outpatient at Marcus. Behavioral assessment will involve observation and monitoring of behaviors targeted for treatment. These behaviors may include communication, social, adaptive problem. The assessment process may take several weeks. It's possible. During this time, problem behaviors may be allowed to occur. They need to know that. When you're doing an FA, that's exactly what's happening. And we don't always do FAs, but when we do, we need to talk about that. We will make every effort to minimize risk, etc. Let's see. Once the assessment is completed, treatment options will be discussed with me. In most cases, treatment strategies will be conducted during session by a trained provider only. The treatment will not be effective outside of these sessions until it's determined that it's effective. Okay, we're going to establish that this is the viable intervention before we train you on it. I understand I may be asked to participate in assessment sessions, that I will be involved in the process of selecting a treatment. It goes on and on. I understand that the services will be provided by trained staff supervised by a licensed psychologist or a behavior analyst or whatever. They should know that you're not going to show up at their door every session, whatever it is. So we put all of that in writing. We also have a responsibilities sheet, responsibilities for the behavior treatment clinics and responsibilities for family and caregivers. And we outline what we will and will not provide. We go through this with them. If you look at the bottom here, again, I know it's super tiny. The parent caregiver agrees to participate in assessment sessions and treatment sessions as outlined by their program. It's the number one responsibility that we put under there. Because patient's treatment can only be successful if the family and caregiver participates regularly, let's see, should understand that your admission will be reevaluated for excessive cancellations. We can't be successful if we don't see your child. We tell them that right up front. Let's see, a couple other things here. I'm trying to see where it might say. Number 11, for some programs, parents and caregivers are responsible for homework assignments, treatment sessions, and data collection. You just put it right in there so that later we can refer that we agreed to this. Okay, let's see if I can get this to work. Oh, goodness. If it doesn't work, oh, here it goes. I'll just take a look at this. So this is our family commitments page. We talk about the overall structure of clinicians, the roles that are involved in the care of their child. We describe it in the bullet point below so they know what the psychologist does, what the case manager does, what the clinical specialist does, what the behavior analyst does. And we also talk about student interns because we have some of that. Let me just scroll down so you can see some things. Participation in parent training. We describe this to our parents. Arrival, attendance, let me just see. I know I'm going through this kind of fast. Training of staff. We have a lot of parents that get a little disheveled when you start messing with the people who are on their teams. You know, somebody quits, we get a new staff member. We want to make sure that they know all staff participate in structured training. The training consists of didactics, role play, video examples, observation of live sessions, slow integration into the teaching session. All of these things, although they may be new to your child, they are not new to teaching and are capable of conducting a session. The CS is responsible for laying all of this stuff we talk about so that they're aware. Variety of staff assigned to work with their child. We talk about the family and relationships. It's important for all staff at Marcus to avoid dual relationships with parents. This means that although we value developing relationships with the children and families we serve, we strive to remain professional with clear boundaries at all times. And we should put it right in writing so that later when we're invited to a birthday party, it's not the first time that we've talked about that. Respectful treatment of staff, how you can voice disagreements and concerns. Absolutely bring those concerns to us, but do it in a way that makes us feel we're a part of the team, that we can address the concerns that you have. This is a very lengthy statement, but I don't know how many times we refer back to the family commitments page. Remember that time when we went through the family commitments? Let me bring it out and we talk about it. How we make decisions. I just want to see where it says, well, I can't find it right now. Here it is. If a parent insists on procedures that are not in line with the case manager's ethics codes, dismissal from the LLC may be warranted. We just say it. We have an ethics code. This is the deal. Okay? Let's see if I can get this to go. Okay, so some other resources that can be incredibly helpful. APBA has some sample contracts and consent forms. If you're a member there, you can borrow those. I highly recommend finding a trusted peer supervisor, somebody that you can bounce these things off of when issues happen. And if you want to practice confronting somebody, I've done that before. Look, I got to have a tough conversation with so-and-so tomorrow. Do you mind if this is what I'm thinking about saying. Would you listen to me? Or are you going to close your ears right away when I start talking? And then, of course, the ethics hotline. Oh, my goodness. Okay. Communication skills. Responding to requests with ethical implications. First of all, rely on your ethics code. I refer to it in my response all the time and talk about the reason why we can't do this or this is an issue. We practice responses because the better you are, the more comfortable you are saying things that are potentially going to be difficult for somebody to hear, the better. And I strongly encourage keeping your emotions in check. If you are feeling anger, disgust, defensiveness, do not communicate at that moment. You will be ineffective, and it will just affect how your message is received. You want to lean on your empathy and compassion. Think about what the person who's asking you to do something that's unethical, what's their intent? What's their perception? Probably it's not ill intent. Probably it's not something that should make you defensive or angry. We want to build rapport, pair ourselves with reinforcement. It's really easy to have hard conversations when people like you from the get-go than when they don't. So really use those strong clinical skills you have with everybody that you work with, parents, staff, students, coworkers, so that you can have these conversations. And clarify intentions and facts. Don't jump to conclusions. So if you hear about or see or something that might be an ethical issue, don't lead with, I have a serious ethical issue to discuss with you. You lead with, hey, I noticed this. Could you tell me a little bit about why you put that on your cover letter? Or, what's your perspective on that? How did that come about? What was the outcome of that meeting that you had where they're going to double our, caseload? Can you tell me a little bit about that? And then they may say, oh, no, we actually said that and then immediately discarded it. Like, oh, okay, great. And you can move on with your life, right? So you want to get their side of the story. When someone else is having an ethical dilemma and you need to confront them, you're always going to rely on these communication skills as well. Addressing ethical issues is absolutely uncomfortable. That's why the ethics code had to put it in there to make us do it, is because nobody wants to do it. It's now in there. So when it's aversive, we can really, we often have two sort of reactions. We either avoid tough conversations or we face them and do a really bad job because we're angry, we're upset, or whatever it may be. So a lot of people think that to address an ethical issue, you can either address the ethical issue or you can be polite and preserve your relationship. And the book, Crucial Conversations, it's the cheesiest line in the book, live in the land of and I love that line so much because you can address an ethical issue and preserve a relationship with a person if you are empathic in your responding, if you think about their behavior from their perspective and don't jump to conclusions, and try to focus on what your goals are, which is not to put somebody in their place. It's not to tell them what they're doing wrong. It's to resolve an ethical issue. I think I actually have that here. Focus on your goal, okay? You want to keep a client safe. You want to make sure this person doesn't engage in an ethical violation ever again related to this. So it's vital that they hear your message. And the best way to keep somebody from hearing your message is to be attacking as opposed to open and supportive. And so we talk about, why am I addressing this with you? It's because I want to teach you something, because I want to bring something to your attention, and I state these things as my objectives. Hey, I have something I wanted to run past you because something that just came up. Do you have a minute to talk to me about it? And immediately makes the conversation safe, and you've got somebody with open ears, and you're going to be much better at resolving an ethical issue if you approach it that way, rather than, why in the world did you take that video on that digital camera? I already told you that that's not that is not okay. Okay, so we have less than a minute. So this stuff is here. Again, just not inferring or assuming bad intent, showing empathy, and indicating your concern, not your disappointment. And that is it. Right on time. Okay, thanks. I'm happy. I think we have like 1 minute if anybody has a comment or something they'd like to share. Yes.
So I'm getting ready, this is my last week of school actually, I'm graduating at the end of this week with my degree in applied behavior analysis, and I'm going to be looking for a job. So I think, I just recently left a position where there were a lot of ethical issues, and I had to leave because of it. So how, going forward, do I know when I find a place, looking for employment, a place that does follow the code?
I love that question. I've never been asked that. So you left a job because of unethical types of things that didn't sit well with you, and you want to make sure you don't join an organization that has ethical issues. I think you can.
How do I know?
This is a lengthy response. I think if you want to stay for just a second, I could tell you what I think. And yeah, sorry.
If there are other questions,
Yep.
maybe I can read the session codes.
Yes.
Where's the handout you referred to several times?
Oh, I sent it in. You
It should be on it's on the website or on the group view app.
Down.
Oh, yes, I'm sorry. Thank you so much, by the way. That was such a valuable presentation. I just want to let you guys know the code for this session is FLE 526. That's F as in Frank, L as in Lynn, E as in Edward, 526. All right, thank you so much.
I'll just stick around if anybody wants to come say hi, but I know it's lunch.